Ensure that all of the instruments are complete, prepared, and functional. There are two types of speculum. You have a disposable one and a metallic one. The disposable one is better and safer to use. Also, it is less traumatic to the patient. First of all, the size of the blade should be picked according to the patient's status. For example, if the patient had multiple C-sections or repeated pelvic surgery, then a longer blade speculum will be more appropriate for these patients. On the other hand, if the patient was multipara, then a wider speculum is the one to use in this case. Lastly, if the patient was primigravida or nullipara, then you can use a shorter and narrower blade. As for the instrument for the pelvic examination, you need lubricant, torch, vaginal swab with its media, and pap smear component, which are thin prep and cytobrush. You can use one of either two types, water-based or conventional smears. The cytobrush has a long part in the middle which should be in direct touch with the cervical canal opening. Also, you need to prepare the endometrial sampling instrument, which consists of two parts, the Bible and the calibrated guide. Be careful that the guide should not be pulled out entirely. The endometrial sampling instrument works by applying negative pressure inside the uterine cavity. And the moment you pull the Bible, the endometrial cells will be sucked into the Bible. Then the sample cells can be emptied in the formalin media for cytology evaluation. There are certain indications for the endometrial sampling, such as irregular menstrual bleeding, intramenstrual bleeding, and postcoital bleeding. Not all the patients require endometrial sampling. To perform a complete pelvic examination, you will start inspection with the exposure starting from the suprapubic area down to the whole perineum. You can cover the thighs. Inspection should start from the top to the bottom, and paying a special attention to these certain structures, which are the mons pubis, labia majora, labia minora, clitoral fold, clitoris, and urethra, which to be visualized, you need to pull the clitoral fold backwards. Labial fold, the fourchette, the perineal body, and lastly, the anus. During inspection, note the hair distribution, observe the structures whether they are normal in anatomy or not, if there are any visible masses, or if there are any notable discharge or bleeding. Description of the inspection should include normal hair distribution of the female genitalia, mons pubis, labia majora, labia minora, clitoral fold, clitoris, urethra, labial folds, the fourchette, the perineal body, and the anus are all normal with no notable scars, bleeding, or discharge, and no abnormal vasculature. Pay special attention to the anal area and look for any hemorrhoids or noticeable Bartholin gland lumps around the anus. Moving on to the palpation, you should start palpating the same structures, looking for deep masses in the mons pubis, labia majora, labia minora, clitoral fold, clitoris, urethra, labial folds, the fourchette, the perineal body, and the anus. In some cases, PR examination is required. Next is the bimanual examination to precisely palpate the vaginal wall and the cervix, looking for any pathologies. To perform it, you must lubricate the index and the middle finger. Then insert them in parallel to the labial folds. While insertion, you can slowly rotate the fingers either in upward or downwards motion, then depending on the level of the cervix and the vaginal anatomy. If the patient was uncomfortable, you can start the examination by introducing only one finger, then insert the other once the patient is relaxed. The uterus is then evaluated by placing the other hand flat over the abdomen, with the fingers pressing gently just above the symphysis pubis, while the vaginal fingers are supinated. The uterine corpus is pushed gently against the abdominal hand. Usually, the uterus is not palpable unless the patient is very thin. You can feel the tip of the fundus and note whether it's retroverted or anteverted. The cervix is then palpated for consistency, contour, size, presence of masses, and tenderness to motion. Then palpate the lateral fornix by grasping them between your fingers and look for any nodularity or indentation. If these things were detected, then it indicates a mass. A closer view of the cervix. The cervix should be palpated for consistency, contour, size, presence of masses, and tenderness to motion. Then, palpate the lateral fornix by grasping them between your fingers and look for any nodularity or indentations. If these things were detected, then it indicates a mass. To end the bimanual examination, remove your fingers slowly and carefully in the same fashion as you entered. Before inserting the speculum, it should be lubricated. The best way to lubricate the speculum is through warm tap water because the lubricant gel might sometimes interfere with the vaginal swab or pap smear result if it was applied haphazardly. The insertion of the speculum is in the same fashion as the bimanual examination. The best way to minimize the pain during the process is to insert the speculum in parallel with the labial folds, and the blade should be kept closed until you reach the cervix. You have to hold firmly while it's closed, spread the labial folds gently, and then insert carefully in downward motion. While you are going in, start to rotate your speculum slowly. When you complete the insertion and start to feel some resistance, slowly open the blades until you have a full view of the cervix. Don't forget to bring the torch in front of you to have an even more clear view of the cervix. The vaginal swab consists of two parts, the swab wand and the media. There are two types of vaginal swab, low vaginal swab and the high vaginal swab. As for the high vaginal swab, which we are going to use today, you have to reach the side wall of the cervix, sweeping from the lateral fornix to the posterior fornix to take a proper sample of the discharge. And then put the swab inside the media and send it for culture. The pap smear has two components, which are thin prep liquid media that has to be prepared beside you and a cytobrush. The cytobrush has an elongated part in the middle, which should be in direct touch with the cervical canal opening, while the sides should cover the cervical surface on the side. Once the cytobrush is in touch with the cervix, you will have to rotate it clockwise 360 degrees around the cervical opening for 5 times. Be careful to not do a back and forth rotations around the cervical opening, as it will destroy the collected cells. After you finish the rotations, take the cytobrush, submerge it into the thin prep liquid media and rotate it 10 times. Then detach the cytobrush from the stick into the thin prep. Close the lid and send it for cytology evaluation. Moving on to the endometrial sampling. Introduce the endometrial sampling instrument inside the endometrial cavity. Once you reach inside, pull the Bible out and this will automatically introduce a negative pressure inside the uterine cavity and collect the endometrial cells into the tube. Slowly pull out the instrument and empty the endometrial cells into the formalin media. After you complete your pelvic examination, you have to remove the speculum. An important part of removing the speculum is that you should not close the blades while the speculum is inside the vagina, because it might close on the vaginal fornixes or on the cervix, causing severe pain to the patient. So you have to exert pressure on the handles and holding it well while loosening the thumb screw slowly. And in the same way that you introduce the speculum, you go out in the same fashion. While you are removing the speculum, you slowly lessen the pressure exerted on the handles, and the blades will be closed naturally by the force of the labial folds.